In Swaziland, a study was conducted where it revealed that 20 healthcare workers were exposed to needle-stick injuries per month in one hospital. Biggest risk to nurses in particular is the needle-stick injuries. I mean, if other parts of the world are using and relying on these retractable syringes, why can't Southern African continent use that and follow that system? Waste disposal is a critical issue that cannot be overlooked by this region as well, because if we are using the standard syringes and needles, safety is not there at all throughout the disposal process. And in that line of disposal, with other workers who are involved, like the support staff who are carrying out the cleaning and the disposal, and where they dispose, if there is no proper incineration in the facilities. You can imagine in community, rural areas where there is no incinerator and everything, they just bury those needles and syringes, and then who knows what might happen tomorrow when somebody else decides, or a child is playing, decides to dig and do that.
My name is Ndombizile Dlamini. I'm a registered nurse working at Mbabane Government Hospital, maternity ward. I had 3 needle pricks. The third one, it was last week Friday, and the patient was positive. I've done my test, it was negative. Then I was given the counseling, then the prophylactic treatment. They said I have to take it twice a day, 1 in the morning and 1 in the evening. But it's so traumatic to know that the patient is positive, you are negative, you don't know if the treatment is working or not. And the experience with the treatment, I felt very sick. I just experienced vomiting, nausea, vomiting, aching of the bones. Patient just pulled back, then it came and pricked me. I think we are at risk of getting the HIV/AIDS. Most of our patients, maybe 50–55%, are positive.
My name is Dr. Lilian Kochola. I work at Pagati District Hospital. I'm the medical superintendent of this hospital. And once in a while we get those that get needle stick injuries. And this is because of using some of the conventional syringes that we have. We got a chance to try the retractable syringes 2 or 3 years ago, and our nurses were very happy with it and the way they were able to stop the needle stick injuries. But we hope that if we can get some funding for the retractable syringes, this is the way that we would like to go as a hospital. For both immunization as well as standard injections, as well as IV injections.
We have the other forms of autodestructive needles, syringes, that once you inject a patient, it locks itself. There is a problem because even when you're withdrawing the drug, the syringe can lock itself. That means you wasted the drug, you wasted the syringe, and the needle is still exposed. That means there are chances that you can prick yourself. That means it doesn't give that ultimate precaution in needle safety.
Of the hospital, that's the biggest problem. Even here you're seeing a backlog. This is from yesterday. We only do like a ton in a day. There's a ton coming today. So you definitely will have a backlog problem. So we need a bigger machine, modern one. This is an old one. They don't even manufacture this kind. Even the spare part is a problem. Somebody died from, I don't know, TB. Somebody died of HIV. But okay, here people get pricked. The syringes and the needles now. They have to go inside the jerry cans. Some people don't have the jerry cans, but they don't even have time to ask for them. So they put them in a box, a carton. So when it comes here, you know, these things come like this. It goes like that. That's why you find like, even these ones, they do, some don't cover the jerry cans on top. So some of it come out. That's why you see it spill all over. But we do the picking on our own. After clearing this, we do the picking.
They play with the syringes. There is even one who was was injected by accident while they were playing. They put this water inside, they splash it out.
They say they are guns. They shoot each other.
They shoot like guns.
I have a friend who was stuck. She was just walking without shoes.